Hi, welcome to Eddie's Research. For this research, I'm looking at claims that music is just as effective as drugs in calming nerves before surgery. So the article that we're going to look at is here. Now, it states, music has charms to soothe the savage beast, the poet William Congreve said back in 1697. We have long known about music's soothing qualities, but researchers now claim it could be just as effective as drugs for calming patients. A clinical trial in the US compared the levels of anxiety felt by patients who were prescribed the drug midazolam and others who were told to listen to music. Those involved in the study were having a type of regional anesthetic or peripheral nerve block. Researchers split 157 adults into two groups, with the first being given 1 mg to 2 mg of midazolam, which was injected 3 times before the peripheral nerve block. The other group were given noise-cancelling headphones and listened to English band Mancini's Union's Weightless, which has been described as the world's most relaxing song. According to Forbes, the band collaborated with a therapist to produce the ultra-relaxing tune which aims to lower the listener's blood pressure, stress levels and heart rate. Pro-operative anxiety is common and can raise levels of stress hormones in the body, affecting its ability to recover after surgery, according to a team from the University of Pennsylvania, writing in the journal Regional Anesthesia and Pain Medicine. The study scored patients' level of anxiety following the 2 treatments and found participants who had listened to music were just as relaxed as those who were given the sedative. However, patients in the drug group were happier with the overall experience, although this may have been because participants were not allowed to choose the music they listened to. Both doctors and patients also thought it was easier to communicate without the music. Following the study, the team said music medicine could be used as an alternative to midazolam before peripheral nerve block injections, but they said further studies are warranted to evaluate whether or not the type of music, as well as how it is delivered, offers advantages over midazolam that outweighs the increase in communication barriers. Now, this article is also mentioned in various other news outlets, but I actually just focused on this one from Sky because, like I say, they're all the same, but you just have a look a bit around them. So, for this bit of research, I'm going to look at the actual study itself and see what the conclusions are. Also, what is this drug midazolam, and what is a peripheral nerve block injections? So, actually, let's look at the actual study itself. So this is the actual study. Now, it doesn't link to it in the article, but it's actually here. Now, you look at this and you think, well, I don't know, this is it. Well, there's a PDF. Unfortunately, the PDF, you have to read it. However, luckily for me, I did this research quite a while ago, and it was completely for free. And here it is. So I managed to grab a copy of it, and it's here to read in your heart's content, and I will upload this to my actual main article on my webpage, so you can read it. So it's actually here. So how do we know that this is the study? Well, it stated in the news article that there were 157 adults split into 2 groups, one with midazolam and the other with music. And here we are, 157 patients, music, midazolam. So you can see there's 157 patients split into the 2 groups. So, first of all, what is midazolam? Well, according to drugs.com, it's used to sedate a person who's having minor surgery, dental work, or medical procedure. So here it is. It's used to sedate a person who has minor surgery, dental work, or the medical procedures. So, again, all these links will be in my article, and here they are, so you can see it in all its happiness values there. And there's more information, we can find it here in medicines.org.uk. So there's a lot there for you to read if you really want to read it. And also in Nice. So again, a lot of information. Probably the same sort of information you see in each one of these things, depending on the the drug type. This is 5 mg, so there might be a 2 mg one, or this is 5 mg for child's there, so there, and so it goes on and on. So as usual with any types of medication or drugs, there are side effects and cases when the drug may not be advised to take. So there it is. Here's from the medicines.org.uk for the clinical precautions. It's a brief list. Includes over 60. Anyone over 60, chronically ill, chronic respiratory insufficiency, renal failure, impaired cardiac function, impaired hepatic function, pediatric patients with cardiovascular. So there's always going to be something, because it happens with most things. There's always something that could cause issues. Yeah. And of course then there's some side effects, as there always is with these kind of things. So here we go. Here's the undesirable effects, or side effects as we most commonly know them as. Frequency not known, so tells you that it doesn't really happen much. Cardiac arrest, hypertension, respiratory hiccups, respiratory dyspnea. Frequency not known, mostly because it doesn't actually happen. But they have to list them because, look, very rare, uncommon, common, but the frequency for every one of these is just not known. Probably because they've never happened before, or they haven't really got much details about it. But remember that the majority of these hardly ever occur. So how does this midazolam, I call it midazolam, it's probably said a different way, actually work? Now on a side note, the drug is used in executions, well, before it obviously happens, to calm the nerves. In simple terms, it slows down the brain activity, which then allows the relaxation and eventually sleep to occur. But in medical procedures, as the main article is about, it causes drowsiness, relieves anxiety, and prevents the person from remembering the procedure. It's probably a good thing in most people's eyes. It's like, I'll just look down below and and in scientific terms, it binds a brain chemical known as the GABA, G-A-B-A, or the gamma aminobutyric acid, or in GABA in brackets benzodiazepine receptor complex, to the brain receptors, which hinders the flow of electrical impulses to the brain. So here's a little description about how the execution drug midazolam works. So again, there it all is, and you can read a bit. Well, maybe not that one there, but you can read about it to your heart's content. Okay, so now we know how it works and what it does. So what's this peripheral nerve block injections? Well, it's exactly as you read it. It's an injection that centers around the peripheral nerve, and to help diagnose and help also reduce pain relief. So used in conjunction with midazolam, first it calms the nerves, makes you relaxed, and then the injection procedures produces the pain relief so that surgery can be painless and the patient will not remember the procedure afterwards. Now, on to the next part of the article, the music. Now, it states that the most relaxing song in the world was Marconi's Unius Weightless. So, we have it here, the link. I will play it because, I suppose it helps when you're thinking. I haven't actually heard this song myself as such. I watched the video, a little bit of it, and I found the video quite relaxing, let alone the music. So we'll put it on now, and you can listen to it, and it will be here linked anyway. Stop it briefly there. Hopefully you heard it all. I did watch my recording. There's an icon down here, you can't see it but I can, and it was flickering quite merrily, so hopefully you've heard it and all. If it hasn't worked then I'll edit that a little bit out and just put the link to the video. But interesting enough, you can look here on the right hand side and there's a 10-hour version. Now I think it's all down to personal taste, and some may say that certain classical songs are more relaxing, or other types of electronic music, say Enigma kind of stuff. Anyway, that's not the purpose of the research, but to look at the actual article in question. And just so you know also, when I had this on in my ears, because I've got headphones on, it's a little bit vibrating on my eardrums, as in the ear, it depends on the earphones. It's like a little bit, not like buzzing, but like a bit of vibration. So I found it okay, but I don't know. I don't think I could relax to it, but that's just me. Anyway, so now we have the song, and like I say, hopefully you've listened to it if it's worked. If not, you can listen to it in your heart's content. The video link will be there. And we know the drug and how it works and the side effects. So let's look at the actual body of the article. So it states in the article, the study scored patients' levels of anxiety following the two treatments and found participants who had listened to music were just as relaxed as those who were given the sedative. However, patients in this drug group were happier with the overall experience, although this may have been because participants were not allowed to choose the music they were listening to. So, like I say, I'm going to upload this attachment into the article, into the actual website that I have, because it's quite useful to read yourself. But you can't go off the website because it's changed. So here are the results. The change in the state trait anxiety inventory 6, the STAY 6 anxiety scores from after to before the procedure were similar in both groups. The music group 1.6, the midazolam group minus 1.6, midazolam group minus 4.2, p 0.14. Mean difference between groups is minus 2.5. Patient satisfaction scores with their procedure experience were higher than the midazolam group. However, there were no differences in physician satisfaction scores the procedure experience between the groups. Both patient and physician perceptions on difficulties in communication were higher in the music group than in the midazolam group. Music medicine may be offered as an alternative to midazolam administration prior to peripheral regional anesthesia. However, further studies are warranted to evaluate whether or not the type of music, as well as how it is delivered, offers advantages over midazolam that outweighs the increases in communication barriers. So let's break this down on how these scores are achieved and what they mean. Now, it's using the STAI 6 thing, which is the Spielberger's validated tool. Now, the STAI is the State Trait Anxiety Inventory, and it's used to diagnose anxiety. And again, here it all is. You can read it. There's not much to it, to be honest, but there you go. It's commonly used as a measure of trait and state anxiety, and you can use in clinical settings to diagnose anxiety and distinguish from depressive syndromes. But for this research, the same tool was developed to use a 6-item short form. Get my teeth in. A 6-item short form of the tool. So here it is from Wiley. If you've ever looked at any other research videos I've done before on medicals or science, you'll have seen me gone to Wiley before. So here we are in Wiley. And there it is, development, the 6-item short form of the state scale of the Spielberger State Trait Anxiety Inventory. Okay. Now I'm not going to delve too deep into this, as it's making my own head swirl, so just trying to fathom out what the tool was initially. So you're very welcome to read upon all of this if you want to. Basically, according to the research paper, the traditional tool has a state and trait portion, each with 20 questions, with scores ranging of 20 to 80. But the STAY 6 has a score range of 6 to 24. But to match the original, they divided the scores by 6 and multiplied by 20 to give a comparable score of 20 to 80. This is making sense, good luck. So now we're going to actually look at the actual table of results. So here we go. So we're going back to the PDF again, and we're here looking at the patient's anxiety scores, so in music, midazolam, and the p-value. So change in this score, and it tells you somewhere around here where all the calculations were. But it took me a while to figure out that calculation things. But like I say, it's all there. You can read it to your heart's content. So, looking at the table, it does look a little confusing, to say the least. But it can be broken down so that it's easy to understand. There's 3 columns: music, midazolam, and p-value. The p-value is a statistical value, and it's the probability that when the null hypothesis is true, the statistical summary will be equal to or more extreme than the actual observed results. Now, I hardly use Wikipedia as a reference, but just from looking here, you can see it definitely is used in more applied maths, so which I'm not even going to attempt to do. That's the p-value, and wait for it. There's some lovely calculations here. Yeah. I know what that means. Yeah, the coin flipping. Yeah. That there. Yeah. The bon. Oh, I know about the Bonferini correction. I did that one in the procrastination one. But yeah, it's involved in all these lovely equations and calculations because we all know what this lot means. I mean, you might do if you're into maths and physics and stuff, but majority of the population probably hasn't got a clue. So I'm just scrolling up here. So they've actually given a breakdown of the actual results themselves, so it's far easier and less time consuming. So we've already gone through this bit before with the results, but here it is again, and it kind of explains it a little bit more, which is from the table below. So it seems they were very similar between the two groups regarding the SD, that's the standard deviation. But it seemed that the midazolam scored lower than the music group overall. Also, they found it harder to communicate with the patients with music on, which is hardly surprising. If I'm the same if I'm listening to music and someone starts to talk. You know, if you've got music on in your head, somebody's talking and you're like, what? They discussed this and thought it could be due to many factors: choice of music, noise versus noise cancellation earphones, etc. etc. So is the article correct in the way it is written? Yes, it is. So, the title. It says music is just as effective as drugs for calming nerves. Well, yeah, it is, more or less. However, patients in the drug group were happier with their overall experience, although this may have been down because participants were not allowed to use the music they listened to. Yes, this was discussed in the later part of the research. Both doctors and patients also thought it was easy to communicate without the music. Yeah, kinda yes. They thought it was due to music type of earphone. But they neglected to say that the patient may be fully engrossed in the music, and an external voice was a distraction. Because if you've got to think about it, if you're listening to music, whatever music it is that you like, and you're relaxed, you know, you can listen to hardcore heavy metal or hardcore trance or whatever, and you could relax to it. And you're really into the music, and you're just mellowing out or whatever, and then somebody starts speaking to you, and you're like, what? You know, it's a distraction. You know, you're trying to relax. Following the study, the team said music medicine could be used as an alternative to midazolam before peripheral nerve block injections. Well, yeah, that was the conclusion. So, there we have it. The article is correct, but I'm still not convinced. As much as I hate using drugs and having many types of pills and potions administered, just listen to music prior to some surgery instead of something that will actually calm me down and block those nerves. But they didn't, from what I can gather. Ask the patients how they felt after the surgery, which you can scroll down here, and it talks about the stuff here. Patients are approached, allow 3 minutes to pass. Satisfaction score, they just gave a score on how satisfied they were of the procedure, of the experience during the procedure. Okay. I think that's something that they need to be factored in. You know, how did they feel after the surgery? Did they feel that it was better or worse? Anyway, hopefully you enjoyed this little bit of research. It's a little bit different to my usual stuff. I like to look at many things, as you know. I have looked at procrastination. That was an interesting article from the website. I've looked at other things as well, like pay gaps, some controversial things, I suppose you would call it, Novichok, but not in the way that the mainstream media has done it. I've actually looked at the how it's made. You know, most people just don't know. They just go with what they say. Oh yeah, well, you know, it can only be made by one person and one person only. Well, can you say the same about paracetamol? No. Also, I've looked at things like a weird building in a strange place in England. I was looking at this weird little building. It was quite interesting, actually, looking at this building. You know, these are all things, like say, if you were to look at every news article in the world and research every news article of whatever it is that you're looking at, you'd be there for the rest of your life. You won't do anything because you're too busy just researching it. So it's nice now and then to just, you know, take everything with a pinch of salt and have a look at something if it comes up and think, well, I'm curious about this music versus the midazolam. Obviously, most people aren't going to be having this, but you never know unless you're on death row, or not even on death row if you're having your as part of your surgery. And you're curious, and you think, well, yeah, I like alternative medicine. I like, you know, bit of this, bit of that. What does this do? Is it any good? Will it work? Well, again, don't just go off the article, because the article will say, this is what happened, and we got this conclusion, and it's all fine. But then when you read it, if you ever want to read it, it tells you a bit more about it, and you can go into the full depth. I mean, it just tells you some references there. See if you really want to go into and read some books and stuff, but I never did. Anyway, hopefully you've enjoyed watching this bit of research. As always, please comment on this video. I have linked every website link and uploaded the attachment as well as the PDF to my actual article itself that's on my website. So this is on YouTube, but obviously my article itself is on my website. And everything that I've just said here, obviously with an extra little bit added now and then, is all in my document that I've uploaded. There's, you know, in 3 versions. Well, it's document, there's PDF, and there's also a zipped file of the doc if you don't want to download the doc straight away and want to scan it, which is what I would always do anyway. Anyway, thank you for watching, and goodbye.